Foundation for getting this platform and making it a big way to reach all people around. First, I welcome all the senior members, Tonia ma'am, Vivek sir, and all other panelists and all the participants. First, I would like to extend my gratitude towards my senior mentors, Dr. Ide sir, Dr. Tonia ma'am, Vivek sir, Prashant Pillai sir, and my ever supporter Dr. Faiz Rahman sir. These are the people who have brought me to the level what I am in strategic implantology now. So coming to the topic. So the topic for the day is strategic implant, an instant reconstructive tool for alveolar, dento alveolar reconstruction. So people might be wondering, what is this instant reconstructive tool? So it's like there are some situations where it is very challenging for a practitioner or an implantologist to place or to restore the teeth and the lost alveolar component in time. So there are some time limitations for few patients depending upon the situations also, where like though it can be done late, but the first preference for all the patient is they want it done as fast as possible, the least traumatic way. So let's see the possibilities of this idea with the strategic implants. So I would like to start with by telling that the eye does not see what the mind does not know. So if we go through that, first I would like to know make you know the importance of what is the difference between dental implants and the orthopedic screws and the trauma implants. So ideally, all the orthopedic screws are also titanium one, which are used to fix bones. But the similar way, the dental implants are also made of titanium, which are placed into the jaw bones to bear the load of the mastication or to bear the processes. So what are the difference? And all the orthopedic screws or the trauma implants, especially the plates and screws, are completely submerged into the body. They are completely closed, either with the by mucosa or by the muscle and the skin. Whereas the dental implants are exposed partly into the oral cavity and it is partly placed into the bone.
Perumal sir, sorry to interrupt you. Please
Yes, sir.
speak louder.
Loudly. Okay. Thank you, Anush. Okay. Is it fine now?
Now it is fine, sir.
Yeah, no, it's fine. Okay, fine. So the difference between the orthopedic screw and the dental implants, the major difference which makes the dental implants highly successful, though we place part of the implant exposed to the our external environment, but still the implant survives. And above that, we sustain the dental implant to multiple magnitude of forces in all possible directions, and that too placed in an oral cavity which is loaded with pathogen. Opportunistic microorganisms, probably opportunistic anaerobic spectrum. So what makes this implant successful is the high turnover rate of the mucosa and the presence of saliva, which lubricates between the mucosa and the implant, which is made possible. Whereas an orthopedic implant, these are completely covered. They should be completely sterile. There should not be any contamination. These are closed until goes with it. But this is the major difference which we have to understand basically. So coming to the maxillofacial and dental reconstruction, following either a maxillomandibular resection or a trauma, there are a few common challenges. Like if you want to go for reconstruction, many times it requires multimodality involvement. Multimodality involvement, like involvement of plastic surgeon, involvement of a dental surgeon, or a implantologist, or sometimes a microvascular surgeon, sometimes an ENT surgeon, so or a plastic. So there are multiple multimodality involvement, which increases the cost, duration, procurement of expertise, and most important factor is the time. And ultimately all these things leads to high cost because of involvement of multiple specialties and multiple equipments and materials. Increase the duration of the treatment, of course. It will take a lot of time for all these people to correlate and allowing to heal and go for the conventional method. Very less compromised bone. See, most of the time this kind of patients will be having a very limited amount of bone, that will be a compromised bone where you cannot restore it directly in many times. So you need to go for a bone graft, or you need to go for additional procedures, or the patient needs to have a compromised processes many times. So the requirement of multiple surgical intervention like a graft, all these things become essential, and the patient has a huge apprehension towards the procedure. For example, if the patient is having a tumor in the jaw, if you are going to tell you are going to resect the jaw or removing part of the alveolus, after that we will take some bone from some other place and keep it over there. After it heals for 6 months to 1 year, again you will do a resurgery and then place an implant, and after that you will wait for 6 months to heal, and then again you will go for the processes. You need to come 3 to 4 times for the processes. No patients will be able to accept this very easily unless the patient is highly